All right, so today's case, we have a 42-year-old male with a left hamstring tear at the ischial tuberosity. This is a work injury and the patient's almost finished with his extended medical leave. He wants to return to work the second time. Oh no, however, but this is the second time he's injured his hamstring on the job. He works road construction where he is the chief driver for both bulldozer and road graders. His lower extremity and trunk flexibility are paramount for returning to this position. At the end date of his medical leave approaches, the patient showing more and more anxiety as he does not feel that he can do the climbing into the large equipment and construction trucks as needed. Each time he thinks about climbing into the equipment, his pain level rises. But he refuses to tell anyone as he does not want to appear weak. In addition, he's receiving pressure from other union workers to delay his return to work. All right, this patient is presenting with nociplastic pain because his hamstring issue has occurred more than once and has been lingering for a lot longer than just an acute injury. The chronicity of his injury can also be seen through the anxiety and pain when just thinking about getting back up in the cab. And the patient does not have any real threat or existing threat of injury to the tissues anymore and is healed, but is still having that pain, so nociplastic. Hand sanitizer. Hey, Zach, my name is Wilson. I'm a physical therapy student here at Concordia. Is that okay if we work together today?
Yeah.
Okay, so tell me, what brings you in today?
Well, I've been dealing with a hamstring injury.
Okay.
I got it at work, and so it's been a couple months now, and I'm supposed to come back to work soon. My medical leave is going to be ending soon, and I do want to go back to work.
Okay.
But I'm a little nervous.
Okay. What would you say is the biggest barrier from you returning to work? Is it nervousness or is there anything else?
Well, this is the second time I've injured this hamstring at work, and it's kind of making me a little anxious just to go back, because I really do want to go back to work, but like there are a lot of things that are stressing me out. Like I really don't want to get injured again, and I don't want like my coworkers to think I'm weak if I go back and I'm scared, and I'm also getting pressure from union workers because I'm part of a union, and they're kind of pressuring me not to go back to work right away, and it feels like I'm just getting a lot of anxiety coming from different directions.
Yeah, well, it sounds like you got a lot of stuff going on, and it's super understandable why you'd be having these feelings and emotions all tied to this kind of injury that you've been dealing with a couple times now. As far as, we move on to your home life, do you have like wife, kids at home, or who lives with you?
I live at home with my wife and
Okay.
and one kid.
Okay.
Mm-hmm.
All right. Okay. So kind of moving back to the your injury and all of that, I'd like to kind of have you rate, like a 1 to 4, kind of from most to greatest, or most to least. What's the most fearful, anxiety kind of producing things with work right now?
I would say the most anxiety inducing thing for me right now is just the idea of like actually operating machinery again right now. And then I would say next is probably making the climb on the stairs and like sitting down and like getting all the way up onto it to operate it.
Yeah.
Next I think is just being at the work site kind of stresses me out. Like I've been kind of avoiding going near construction sites because it kind of freaks me out.
Yep.
And then last I would say is honestly I get a little bit of pain just even thinking about going back right now.
Okay. So that pain comes on just sitting here thinking about it.
Yeah.
Okay. All right. Well, I think you would benefit a lot from, it's called graded exposure. It's where it's a tool used to reduce the fear and avoidance of kind of these emotions that you've been handling. And it's a technique that will help you confront this situation, like going back to work, like you said, operating the machinery, even climbing up the stairs to get into the cab. That's big, as well as being in the construction site, and then just thinking about it. This will help kind of tackle those barriers, if you will. With graded exposure, you can expect to gradually confront those situations and movements. You and I can start with some easy exercises that will gradually climb up into those more real life situations. So we can start with small stuff, like starting at the bottom, and then we can progressively work our way up to the top. So that one day maybe we can get back in the cab, right?
Mm-hmm.
Yeah. And so I'll ask you to numerically kind of rate your anxieties throughout today's session on a 0 to 10 scale. 0 being, no, I don't have any fear with this, whereas 10 will be, we need to stop right now because the fear and anxiety is building too high. And so we want to build that confidence for you to use the skills that you already have, and then we want to get you to return to your job. That's our end goal, is to get you back in the cab, okay?
Okay.
All right, and so the frequency for this kind of exercise that we're going to do today is, these are things that you can do once to twice a day without any supervision, just to kind of establish that independence, to say, you know what, I can do this on my own, because it's kind of a you versus you battle in a way, isn't it?
Mm-hmm.
Yeah. So well, the first thing that we want to do with graded exposure is we want to establish and identify the source of fear. And I had to grade kind of where your fears are. Number 1 being operating the machinery, all the way down to just thinking about it. And so I'd like to start out at the bottom, just thinking about it. We want to develop our goal, which kind of, would you say, is getting back up in the cab again?
Yeah.
Yeah. And then we want to progressively perform the activity, followed by finding the right tools that'll kind of get us there. So it's like the correct treatment and the specific exercise that we do to kind of facilitate that gradual progressive work. And then we want to face our fears as much as possible. So all those 4 things that you told me, we want to try to hit those as much as possible. We want to kind of find that limit and kind of work there, and then before you know it, there is no limit. And then you're working again. Yeah, so you've conquered your fears. So right now, just sitting here, what would you say that kind of fear, anxiety, avoidance kind of feelings are on that 0 to 10 scale that I talked about?
Right now, it's probably at like a 3.
Okay, just sitting here, we're not even thinking about it, we're just talking. 3 out of 10, you're saying? Okay, all right. Now I want you to, you got the sounds of construction around you. You got, your manager kind of telling you, hey, Zach, get up in the cab. You're gonna walk up the 4 or 5 steps. You're gonna sit down in the cab, get your hands on the wheel, hands on the gears. Thinking about all that, where does that put you with this?
It's a little higher. It's probably like a 4.
Okay, so you went up 1 level, a little bit, yeah. And you get that pain kind of in that hamstring too coming on?
Yeah.
Okay. All right. So from there, what I want us to incorporate a little bit now is just called some deep breathing exercise. I like to call it diaphragmatic breathing. We can put our hands kind of on our rib cage, because the goal is we're going to breathe in through our nose, get a really nice deep breath, and I want you to expand your ribs out into your hands. I want to get a big deep breath, fill up the lungs, and then we're going to slowly exhale back out. That sound good?
Mm-hmm.
All right. So breathe in again. All right, we can do that one more time. Big breath in, filling up the lungs. There you go. And breathe it out. All right. So how are we feeling just sitting here on that same scale, 0 to 10? Does that change? The same? Worse?
That helped a lot, actually. I would say I'm down to a 3, or maybe even a little better than I was. So like maybe a 2 or a 3.
Look at that. We just think about it, we're getting better. Look at that. It can be conquered. All right, so the next thing I want us to do, so that was kind of the smallest fear that you had, is we're going to move on to, we're going to progressively move up the totem pole. So the next one is just listening to a construction zone. And you said earlier that you've been kind of avoiding a construction zone, right?
I have.
Okay.
It's just I don't like going by them, just because like I'm just worried that if I hear too much or see too much, it's gonna make me feel really stressed.
Yeah. Okay. And I totally understand that. Yeah. Yeah. So what I have here is, you can find it on YouTube. There's a 10-hour construction sound video that I got pulled up here. So I just want us just to listen to it. And I want you to let me know if any of those kind of fear and anxieties get really high that you need me to turn it off. So I'll turn it off immediately. Or, we'll just sit here for about 10-15 seconds. All right. Does that sound like something that you want to try?
Yeah.
Okay. And before we listen to this, on that 0 to 10 scale, what would you kind of rank your fear at? You said it was a little lower. Has that changed, or?
I would say I'm still in the same area, but I don't know how I'm gonna feel after this.
Okay.
Yeah.
All right.
So
Yeah.
2 or 3.
So just let me know if I need to stop it immediately. Okay.
Mhm.
All right. So I'll go ahead and I'll start that. Does that kind of sound like your construction site?
Yeah.
Yeah?
Reminds me of it a lot.
Okay. And so thinking of that, we just heard it. How does that feel? How does that make you feel? 0 to 10.
It's a little harder than the last one. I would say I'm up to like a 5 now.
Okay, up to a 5. So a little bit higher than what you came in here as. Let's try that diaphragmatic breathing again. So hands on the ribs. Nice deep breath in. Fill up the lungs and exhale for me. And we'll do that one more time. Okay. And now where are we sitting?
I'd say I'm probably at a 4 right now.
4. Okay. So just like when you came in here, you're sitting at a 4.
Mm-hmm.
If that's okay with you, I'd like to move on to another exercise that's going to be a little bit harder.
Sure.
Well, it may be. We'll see. So this one I want us to kind of. You're sitting in a chair now, but when we stand up, so go ahead and stand up for me. Yeah, it's no problem here. Let's say we're facing this way. And so does your cab have 4 or 5 steps trying to get up into the bulldozer?
Yeah, I think it's 6 or 7.
6 or 7 steps. Okay. So a handrail on the left or the right?
Both.
Both sides? Okay. So I want you to just go ahead and kind of be looking up. I want you to hold on to the handrails, kind of thinking that you're there. And I want you to go ahead and you take those 6 to 7 steps up. And then I'll have the chair right there. And I want you to go ahead and turn, just kind of sit just like you're sitting down in the cab. That's only something you want to try?
Yeah.
Okay. All right, so I'll turn the chair this way, and then the stairs are right here. I'll have the 2 railings. And so if at any time when you're doing this kind of movement, the anxiety kind of heightens or gets a little greater, I want you to stop and do that diaphragmatic breathing. Okay. That sound good? All right, so before we even do this, what would you kind of rate that fear at right now?
I would say it's the same right now as it was just a minute ago, probably a 4 right now.
Okay. All right, so going ahead and envisioning that we're kind of going up the ladder into the cab. And your handrail's there. Now go ahead and take a couple, those 6 to 7 steps for me. You're going up the stairs right now. There we go. Diaphragmatic breathe. Kind of bring that heart down. You got this. There we go. All right, you take the 6 to 7 steps. Go on and turn. Take that seat. Right there in the cab. Still doing okay? All right. Go ahead and put your hands on the wheel for me. All right, how does that feel?
It's a little higher. I'd say I'm up to maybe a 7 now.
Okay. All right, then you can go ahead and take the hands off the wheel. You're not on the cab anymore. You're just sitting in the chair. We're just working. You can go ahead and put the hands on the ribs. Focus on bringing that breath, moving those ribs out, getting the biggest breath you kind of haven't really got before. Filling up the lungs. Good breath out. There we go. Good exhale. There we go. How's that feel?
A lot better, I would say. Probably back down to like a 5 now.
Back down to a 5. Okay. Still a little higher than what you came in here as, but yeah, go ahead and turn for me. All right. So we got through all those 3 stages there, and we only went up 1. That's a huge achievement. I think we're doing great and we're making good progress. How do you feel?
It's still really scary, but it's better than I thought, because I was expecting this to be I didn't realize how much that would help, the breathing.
Yeah.
And, how I could, it might hurt, but it's not going to hurt as much as I thought it was.
Exactly. Yeah. And I saw that firsthand here. You could do that 1 to 2 times just at home. These are things that you just kind of envision and you just do it and you get kind of that graded exposure to it slowly and progressively. We really don't want to push it, right? And so the next thing I kind of want to do is sort of track this in a way. It's called the spoon theory. And do you ever notice how after those long days, working with construction and doing all that, you come home and you're just drained, you're tired, and can easily become irritated sometimes? Yeah. So this spoon theory is kind of how we better understand how we have a set number of tasks that we can do in a day, or we call them spoons. And for this, it's that how many we can complete and spend the spoons before we hit that limit. And so this will help for that. For example, showering or just getting ready for the day might be a spoon or 2. It kind of differs with everyone. Exercising or working could be up to several spoons. And everyone kind of has their own number of spoons throughout the day that they can use. Some people might have 20, some people might have 50, some people might have 10. And so from this one, I really want to use this tool to measure how your everyday activities and tasks can be better understood and find the limits for it, and kind of just see before we hit that wall, and that's where we can work. We can do this by just tallying up your everyday activities that you do right now. Like a typical day, I want you to write out, I wake up, I get out of bed, 2 spoons for that. I kind of want you to gauge it. That way, it's a lot more stuff that you do. It's based off of your schedule.
Okay.
And so we'll do this, and I want you to rank how many spoons that every activity could be.
Okay.
Does that sound like something that you want to try?
Yeah.
Yeah?
Yeah.
Okay.
I mean, it seems good just because it seems important to, be mindful of how much energy I have left for other things that I need to do.
Yeah, exactly. And so I think for that one, you could use your phone. You can write down the whole schedule if you have your planner on your phone, or if you're like me, a little old school, you got your paper hard copy of your planner. You can write down, I did all these tasks today. I don't have any spoons left, honey. Yeah. So
I am
you can
old
do
school.
that. Yeah, good. It's me too. And so I kind of want to finish with, so there are some kind of factors I would like to just discuss. Kind of, we've gone through a treatment today. And with disability and going from work to not working, there's a lot of stresses that can come up from it. The biggest one is economic stress that can come up. I know you're married and you have a son at home, you said. And I just wanted to know, for missing work, are you guys still able to pay the bills, the rent, the mortgage, groceries? Is there any problems that have been coming up from work?
Yeah, I mean, I know I have been getting a little bit less, but my wife is also working full time, and so it's been a little more stressful. But we haven't been missing any bills or anything, so everything's stayed caught up at least.
Okay. Yeah, I just wanted to bring that up to see if there's any issues that I can help you with in that front. The next thing I want to talk about with is with education levels and kind of everyone's backgrounds can be a little different. A lot of high school health classes can kind of miss talking about pain management and other diagnoses and such. It's not, if you don't have that background, it's kind of hard to understand your own pain. And so one thing that I wanted to talk about is you have this left hamstring issue. It's been a couple months and it's healed, but you still feel that pain. So I wanted to clarify that the more movement you do won't tear that from the bone or make it any worse. It's totally fine. The tissue's there, they're not irritated. It's just kind of how you feel coming from this issue. And so I just wanted to kind of relay that information to that. Education, you're doing great.
Good.
And so it won't tear or anything. The tissue's fine.
I was worried about that.
Yeah.
So that's good.
Yeah. So the more that we move and kind of go forth from here, the less irritated it should get. Does that sound good?
Yeah.
Perfect. All right. So some strong, helpful tips that would be great for a therapist who is treating a patient in this sense would be to build a strong therapeutic alliance. And this can be done through just being totally transparent and honest, upfront, and that leads to optimal treatment, as well as active listening. That's maintaining eye contact. You can nod, you can do some nice mannerisms, and kind of notice how that's been kind of portraying to build that strong therapeutic alliance. And lastly, you can also do some mindful breathing techniques, like what Zach and I did today. You can do that diaphragmatic breathing, calm the nervous system down, because when everyone's relaxed, it's all good.